The Health Information Department manages the patient medical record in any format. Our mission is to ensure the patient record is completed accurately and timely so that the information is available to the care providers and the patient while still ensuring privacy and confidentiality. H.I.M staff begin the day scanning records that have come in overnight so that the care team has access to this information. Staff verify that required documentation for current inpatients such as history and physicals are available in the record as soon as possible so that they can be reviewed by the provider prior to the physician evaluating the newly admitted patients. We have several specific processes that H.I.M staff are responsible for monitoring and completing. We ensure provider documentation, including dictation, voice-to-text, and self-type notes, are professional and accurate so that they are available for ongoing patient care. Although we use an electronic health record, we still receive paper records such as when a patient brings their personal medical records to us from an outside facility or an external test is completed. Release of information really means sharing the patient's health history with other caregivers involved in the patient's treatment. Records may be requested for a variety of reasons in addition to direct patient care. For example, to support hospital charges billed, for payer and quality audits, and many other purposes. Coding is also a task that is completed in the H.I.M department. Codes are assigned to all patient diagnoses and procedures for patients treated here at the hospital. These codes are assigned based on the caregiver's documentation in the patient's medical record. They are used to support a patient's bill for services. H.I.M has changed so much in the past several years, as has healthcare in general. You see, we still have many paper files. We stopped adding to these files when we began using an electronic health record in 2010. At some point, these files will be transitioned in some way to an electronic format. Today, the records are all electronic with access granted based on user role and security. Health information can come from a variety of locations. Some records are still mailed to H.I.M. These records are then scanned into the patient's health record as correspondence. These are typically from the patient's distant care providers. Records can be uploaded to a secure portal by providers too. H.I.M staff verify the records are appropriate and then release these into the patient's Mary Greeley electronic health record. These records are then viewable by the patient's care team when the patient comes to the hospital for admission, a procedure, or other hospital services. Some areas that will continue to grow include privacy and security needs, and how that data is used requires information governance and management of the data. In the past, patients had to come to the H.I.M department to fill out a form so that we could mail their records to them or request records from outside facilities. Today, the patient can use a web-based portal to request their records. The records are released to a secure portal, and the patient can view or download the records in their computer in their home. On the other hand, there has to be a fine balance between protecting patient health records and allowing them to be available for continued patient care needs. While the nurses and other caregivers are doing their very important work of actually taking care of the patient, we are taking care of the paper, or today the electronic records.